Waimea is one of the largest Hawaiian homestead population in the state. I'm actually a homesteader myself. We were at a homestead meeting one night. One of the community asks was for a healthcare clinic that understood the uniqueness of our culture and could provide services that were for Native Hawaiians. And so that was our mission and our vision and our focus. We were born from that. Puka O Ke Ola is a rural health clinic. We utilize a medical home model, which integrates primary care with behavioral health. So we have 2 psychologists as well as a psychiatrist. We also have a Native Hawaiian health practitioner who specializes in lomi lomi, la'o lapa'o, as well as acupuncture. I'm Dr. Clarion Kealoha Bode. I'm the Chief Executive Officer as well as a provider at Puka O Ke Ola. I'm a clinical psychologist.
I think it's important to have a clinic like this because, for one, it's small, it's comfortable. You know, we have Native people here that went to the same school that you did or that your parents did. You grow up together, so there's an understanding of your needs.
The beautiful yet complicated part of working in a small town is that our patients are also our ohana.
I was born and raised on the Big Island, raised out here in Waimea. I am a mother of 3. I use Puka O Ke Ola as my personal primary care, as well as my children. They've been seen here from birth. There's the behavioral health services. You know, where can you go to walk into one place and get behavioral health, primary care, and, you know, cultural indigenous medicine?
So COVID absolutely sent us for a spin, and the adjustments were fast and furious. The very first pivot was to come up with protocol to keep our patients as well as our staff safe.
If I needed the doctor to come to my car to see my child because they had a cough, it was easy. They came out in full PPE, you know, addressed whatever concerns I had and sent me on my way.
I would say the other concern was that people that we see normally maybe once every other month or once quarterly to help them manage their chronic disease, that we were not going to let them slip through the cracks. We were probably already working at our capacity before COVID. Because there's a small community, we don't have enough behavioral health providers, psychologists, and psychiatry. Once COVID hit, we were running waiting lists of 200, 300 people needing support.
Commuting far to places like Hilo and Kona is difficult, which I feel there's a need for more services out here.
A lot of community need. So we tried our best to respond by opening more spots. It didn't matter how many spots we opened, they were full. So we actually tried to bring on an additional psychologist, and we hired a psychiatrist to try and answer that need. If you don't understand that the patient population is resistant, then you will go nowhere. It's not about giving a directive. It's about helping to facilitate understanding with aloha. There's fear around trusting systems of care that have not necessarily been pono.
It was scary, just the unknown, and then hearing things through the media, a lot of the things that was going on in the stateside compared to what we were starting to experience here. It was more alarming.
Taking the time to listen to the rationale behind the fear. It was persistence and not judgment, and allowing them to move in the direction of acceptance on their own terms.
So when COVID hit, it was very comforting to know that Puka O Ke Ola kept their doors open. Any kind of question that I had, I knew I could come here.
There wasn't a way that we were going to be able to financially sustain the people that were working overtime to make sure that people were staying committed to chronic care plans and chronic care conditions. So the funding actually helps us to continue with the continuity of care, even if they were not billable hours.
They give you a true meaning of ohana. You can come here and know that your needs are going to be met, whether it be primary care, behavioral health, and well, for me, I always leave here knowing that I'm in good hands.